Hi, my name is Maithili. I'm an IBCLC and a family physician. I'm the Director of Mother and Child. Let's talk about breastfeeding and how the latch mechanics work with the breast and a baby's mouth. Okay, so if that's the breast and that's the tongue of the tongue is meant to stick outwards and lift up so that the baby is able to form a seal between the breast, the tongue, and the top of the mouth, which is called a palate. If the baby is able to stick the tongue out and up, they form a seal, and that seal is now going to be not shifting anymore. The back of the tongue and the jaw drops. What then happens is it lowers the intraoral pressure, and they're basically going to be drawing milk. Does that make sense? Now, if the baby has something called a tongue tie and the baby's not able to lift the tongue up because there's a piece of tissue sticking and pulling the tongue down to the floor of the mouth, the baby's not going to be effectively finding a good seal or a latch. If it's a real tongue tie, then we might need to do some kind of an intervention, right? But sometimes it is really just jaw, tongue, and mouth tightness. Sometimes they have a bit of a torticollis where the neck of the baby is kind of tilting onto one side more than the other, and that could be for many different reasons, right? Because we work closely with an osteopath. And an osteopath is like a physiotherapist, but they work on the fascia, so they work on the muscles to kind of release those muscles so that the baby is going to be able to form a much better seal. Sometimes we use tools like a nipple shield, or sometimes we do suck training with a straw or a tube or even a cup. But using a tube sometimes helps the baby learn and coordinate the suckle and the tongue mobility at the same time. I hope this helps.